Good morning, good evening, good afternoon to everybody. Welcome to our webinar, the second of this year's series on stakeholder engagement in value assessment. So I'll introduce myself first. My name is William Dorling. I'm the market access lead for Pfizer in Latin America, and I'm the co-chair of the Value and Access to Innovation Committee at FIFARMA. We have a long-standing relationship with ISPOR to bring these webinars, and today we're going to be looking at a very important topic for Latin American health systems. How do we improve the level of stakeholder engagement in value assessment and ensure that members of society from many different walks of life have the opportunity to be participants or to have their voice heard in the process of deciding which medicines have value for society. I wanted to start just by some words of introduction. If we can go to the first slide to frame today's conversation. I think the first point on the previous slide was this is basically the outputs from the most recent last year's HTAI policy forum, and this is really, I think, just recognizing that the value assessment community in Latin America recognizes that this is an area where there's progress to be made. I think, you know, the majority of people represented in that forum felt that right now the deliberative processes that we have in place are not fully adequate. So this is an opportunity for us to make progress. If we go to the next slide, we'll see that there are a lot of obstacles still remaining that stakeholders identified to bringing more inclusive and improved deliberative processes to our region, some of which are probably common to all health systems, and some of which may be, you know, specific to Latin America. But that said, I think the value of improving stakeholder involvement is recognized by nearly everybody. And if you go to the next slide, you'll see that there's a very high level of priority assigned to involving patients, policymakers, and experts from different walks of life in the process of determining value. So that's really what we're going to be talking about today. And it's my pleasure to introduce our two speakers who are themselves experts in this topic from slightly different backgrounds. So if we can go to the next slide. Our first speaker is going to be Aline Silva, a partner and a researcher for knowledge transition community and patient engagement, a member of HTAI herself, and formerly a member of the health technology assessment community in Brazil, and a researcher at the University of British Columbia who's been doing a lot of work on ways in which patients can become more practically involved in health technology assessment and value assessment processes. And then our second speaker, Javier Guzman, is the Director of Global Health Policy and a Senior Policy Fellow at the Center for Global Development, previously Technical Director of the MTAPS program at Management Sciences for Health, and has been involved in helping many governments to build their health systems to ensure sustainable access to medicines and pharmaceutical services. He has a background as a physician and a researcher, as well as a policymaker, and experience in several countries. So Aline will be sharing a little bit about the perspective from the patient's view, and Javier, I think, is perfectly placed to complement that with a view from his work with governments and other policymakers about how we can advance in this critical area. So everybody will have the chance to ask questions at the end. Please also feel free to use the Q&A to ask questions as we go through the presentation. And without further ado, I will hand over to Aline to start our presentations. Thank you.
Thank you, Will. Thank you, ISPOR and FIFARMA for the invite, for the invitation. It's a pleasure to be here. And it's always a pleasure to share knowledge and to share a little bit of this journey about this research that I've been doing for such a long time in about patient public engagement and deliberative evidence-based decisions and health technology assessment. So my name is Aline Silva, as William introduced me, and I would like to first honor and acknowledge the land where I live, as the unceded territory of the Coast Salish people. So I'm here in Vancouver, in Canada, currently. Next slide, please. And I also would like to make this declaration of interest. I am a researcher from University of British Columbia and University of Brasilia, in Brazil. I'm also part of the steering committee of the HAI patient and citizen involvement in HAI interest group. And I'm co-leading the project Stakeholders Perspectives of Impact of Patient Involvement in HAI. And I'm also a patient. I've been under oncological treatment since 2013. And I've been acting as an independent patient advocate. And currently I'm also a patient partner at Patient Voice Network, which is an umbrella patient organization here in British Columbia, Canada. Next slide, please. So here we have the agenda for this presentation. So in the beginning, I will start talking a bit about the health technology assessment in Latin America. And we are going to speak about stakeholders engagement and evidence-informed deliberative processes, stakeholder engagement in Latin America. And we are going to present the project that we are currently doing, the methods, and some initial results. Next slide, please. So the health technology assessment in Latin America is it's fairly recent. It started to become part of an important health sector reform in the late 90s. So currently we have Argentina, Brazil, Colombia, and Uruguay with official HTA bodies. They are members of INATA, which is the International Network of Agencies for Health Technology Assessment. But we have many other countries that are part in the region that are part of the Health Technology Assessment Network of the Americas, the REDEXA. Next slide, please. And we are here today to talk about the stakeholder engagement in evidence-informed deliberative processes. HTA is one of the processes that is based in evidence. So it's decision-making based in evidence. So why does engage the stakeholders, the different stakeholders, is so important? So based on this, the source, evidence-informed deliberative process for health benefit package design. It's a very new publication from last year. We have 7 P's for 7 different stakeholders, which is we have patients and public, providers or health professionals, purchasers, payers, policymakers, product makers, and principal investigators. So all these stakeholders, they have diverging social values, they have different interests, and all these different interests result in different perceptions and perspectives about the value of the different technologies, the different health technologies. So engaging all these stakeholders contributes to the legitimacy of decision making. How? Because they identify a full range of interests. They improve understanding among different stakeholders so they can share their values and their perspectives, and the other stakeholders can understand their side, their view. And also they provide specific knowledge. So for example, patients, they have a unique knowledge and unique experience with that specific disease or with that specific technology. Next slide, please. So I just would like to share with you one of the initiatives about patient involvement in HTA specifically. So we have this, the HAPCIG, which is this interest group at HAI. And we have different projects. So this group in specific, they have 8 different projects. They are trying to understand better how this patient and citizen involvement works and how we can improve this. So we have projects that are trying to understand the patient involvement in the whole Europe. So it is 360 degrees HA patient involvement project. We have another one that is patient participation at the organizational level. The stakeholders' perspectives of impact. That is the project that I'm leading currently with Veronica Gusset from Colombia. She lives currently in France. We have another project that is low and middle income countries. So they are assessing and researching how patient citizen involvement happens in low and middle income countries. Patient preferences, patient insights research platforms, which is another very interesting project. Implementation of summary of information for patients that can help the industry to bring this patient information to their dossiers, as an evidence for their health technology assessment, and patient and public involvement at HAA annual meeting. So I'd like to invite you to take a look at the website. Next slide, please. And specifically, when we talk about stakeholder engagement in Latin America, we can see that we have a very recent democracy. So over the last 4 decades, we had a transition to democracy. So it's a very young democracy. We are now in a new phase of experimentation with participatory governance, involving a variety of ways of directly engaging public and citizens with the government. So the government nowadays, they are less likely to have a monopoly over citizens' livelihoods. The information nowadays flows ever more freely, and we have more and more non-governmental organizations. So the government tends to respond with new forms of citizen participation. And the variety of purposes, locations, institutional design, norms, and effectiveness of this participatory responses is almost endless. So this is a very interesting source. It's a book edited by a researcher here from University of British Columbia, and they talk about this participatory democracy in Latin America. Next slide, please. And to study more, to understand more the stakeholder engagement, and specifically the patient engagement in Latin America, we are now conducting a project to deepen this understanding, how patients are getting involved in the region. So we know that the stakeholder engagement, but it's mainly patients and public engagement, it has been developed in several HA agencies, including in Latin America. We have some very robust examples from Argentina, Brazil, and Colombia. So these are some countries that have implemented formal mechanisms to involve patient systems. So we know the patient voice being articulated and listened, but is this voice being heard in a way that patient's perspective impacts the decision making? So to know more about this, we are conducting this project. Next slide, please. And the objectives of this study is to provide a deeper understanding of the involvement of patients in the HTA and regulatory processes in Argentina, Brazil, and Colombia, considering the impact of this involvement in the decision making. So we want to describe patient participation processes in different organizations in these countries. We want to know more about the gaps and best practice of patient participation and some recommendations to address these gaps. Next slide, please. So we are following the methods that I followed in my PhD thesis, my PhD project. which is a three-phase mixed method. So in the first phase, we are conducted a rapid review, and also we are conducting interviews and surveys with different stakeholders from the country to understand the participation processes, identify gaps, best practice, and the impact of the patient involvement. The second phase, we will identify from those interviews and surveys, we will then identify the main gaps and the recommendations. And in the third phase, we will have a qualitative description to integrate the previous results and writing the deliverables. Next slide, please. So the key stakeholders are some organizations in Colombia, Argentina, and Brazil. We have Conitec from Argentina, Conitec Brazil, ANS, which is the regulatory, one of the agencies in Brazil. We have IET from Colombia in Lima, the regulatory agency as well. And we also are interviewing Latin America active patients and patient groups, industry representatives, and other leaders that are being identified by snowball sampling. So we have so far in our sample to be invited 11 participants from Argentina, 22 from Brazil, and 33 from Colombia. And this was not on purpose, okay? Those numbers are very funny, 11, 22, and 33. Next slide, please. So here we have some initial results, and I am bringing here some of the quotes that I could extract from the interview so far. So one participant said that the HA bodies, the organizations, the health organizations, they cook the soup and invite us just to taste it. So they are talking about how important is an earlier participation and a participation across the whole HA process. So they want to be part of the process of cooking the soup. Another patient said, participant said that NICE, for example, in UK, they train the patients before the meeting. They send the rules and they say in what part of the process they have a voice and when they don't have a voice. So managing expectations when you are engaging stakeholders, and mainly patients, is very important. And also capacity building, training. Training is something that I heard in all interviews that I conducted so far. So the stakeholders, they have been saying how important it is to train the people, the patients, mainly patients specifically. Another person said we need to teach the authorities. So it's also important to increase this awareness about the value of patient engagement and stakeholder engagement in general, because they say the view of these stakeholders, maybe people that are not from the HA bodies, they say that they feel the organization tend to be very close. Knowledge is concentrated in a few people. Another person said that there are, in Latin America, in a specific country, there are many patient experts, but it's just these patient experts. So the knowledge is very concentrated. So that's why it's important to train patients. There is no active participation, and there is not so much listening to patients within the HA. Another patient said some patient groups still need to learn how to knock at the door. So advocacy training is also very important. Next slide, please. So here are some of the results that I could put here in the best practice that I could identify. So the best practice in the region in general, I'm not separating by countries, not yet, but the best practice that some stakeholders mentioned is digital and online participation brought a good chance to some processes. So in some countries, the opportunity of participate, be engaged by digital and online tools was a good opportunity. There is a political willing to implement change. There are many patient experts willing to participate. Public hearings and other in-person meetings where patients can sit at the table are very important. Just one second, please. Sorry about that. So they also mentioned, the stakeholders that were interviewed, they also mentioned that there is a great articulation between patient organizations in some countries, and the guides that some countries are providing to support patient participation are also one strength in Latin America. Next slide, please. So some gaps that we found so far: patient knowledge about the HA processes and the regulatory processes, it's a gap. So even among patients that are involved in this process, they are sitting in the table, there is still a lack of knowledge, of information on how they can participate, on how the HA process works. Another gap is HA bodies acknowledgement regarding the value of patient engagement and reward data. It's also a gap. So they know they have to do it, but they don't know why or how. There is a lack of trust and confidence to build relationships, mainly towards pharma. So that is this. It's still something that we need to work on, because it's important. We know that pharma is an important stakeholder, and it needs to be involved in the dialogue. It's a very strong stakeholder that needs to be engaged. There is lack of transparency and information regarding processes, purposes, roles. So why are patients in this table? One participant mentioned that the person was speaking to one person in the government, and when she asked why are patients in the table, the government mentioned it's because we need them, we need to have their voice, but they don't know how, why. So what do they need to bring to the table? So patients, they are still feeling lost as well. They don't know how they can contribute. So that's important to have this more systematic methodology. So they need this process of engagement be more clear. It needs to be more clear. There is no evaluation and impact measurement. So how do we know that patient engagement is making a difference? There is lack of methodology to analyze patient input, lack of dialogue. So some patients in a specific country mentioned that this HA body there is a closed door, mainly for patient groups. So there is a lack of dialogue. They are not being receiving replies, responses, even though when it's an obligation from the government needs to reply, and they are not receiving it, the replies, the answers. And one big gap is in Latin America specifically is the frequent change of administration. So every time there is a political change, everything changes, and there is a lack of continuity. Next slide, please. As recommendations, we found that people, they are in need of better representativeness and diversity. So they need more seats, they need more disease being represented. So rare disease, people mentioned that rare disease, there is a lack of dialogue as well. So they are recommending a better representativeness. They are recommending a transversal engagement. So an engagement, a patient engagement in the whole process, not only during the technology assessment, not only when there is a technology being discussed, this is going to be to be available. They want to be part of the whole process. So I think the organizational engagement is also an important thing that we need to discuss in Latin America. Clear participation methods is the need. Patients and HA bodies need training, especially patient groups. Patient groups need to learn more about how to do advocacy. Someone mentioned that they need to know how to knock at the door. Clear expectations and role definitions. More government support to provide this training so patients can be multipliers. They can multiply the knowledge that they receive, and transnational experience to share what's working in other countries. This is another recommendation that one participant saw. Next slide, please. And that's the end of my presentation. Please, if you have any suggestion, any question, please get in contact, and it's going to be a pleasure to reply and to share more with you. Thank you.
Thank you very much, Aline. I think very interesting and useful and timely research. So I'm sure we may have some questions at the end. I think unless there are urgent questions at this point, maybe we can move on to Javier's presentation, and then we will come back for questions with both panelists after that. Over to you, Javier.
Thank you, William, and thanks for the invitation. It is a pleasure for me to speak a bit about, the experience I've had in Latin America, but also in other regions, and what the state of play is in terms of the decision maker perspective. Next one, please. So, we heard a bit about, the importance of stakeholder participation and patient participation, specifically as a right in a democratic society. And that is, something that is actually new to some extent. We heard from Aline how, institutions have been strengthened and created in Latin America in the past few decades. So there's a value in stakeholder participation just for the sake of, having these democratic values. But also I think in health, it is important to acknowledge that people do want to be part of the decisions that affect their lives. And that is not just, the patients, but also the physicians, but also, healthcare professionals and policymakers as well as, a broad range of stakeholders that do want to be engaged in this conversation at different times in different places with different vehicles, and we'll get to that in a minute. But I wanted to reinforce a point that I think is very important, which is it's not just about the democratic process. It's not just about increasing the legitimacy. It's not just about a best practice. It also brings additional benefits, but also additional challenges. Next one, please. So in Latin America, there has been some work in terms of identifying the best practice principles for health technology assessment. And that's some work that was done in 2017, looking at all the different best practice principles worldwide. And this group of experts decided to, go for 5 main best practice principles. The second of which is basically stakeholder participation. So as I was saying, is recognized as a best practice principle. However, next one, please. However, it is important to acknowledge that, there are just many elements that we need to take into account when looking at, stakeholder participation. We talked about legitimacy and accountability. I would like to emphasize the quality of the decisions. If we hear, different perspectives and different opinions and we get additional information from different stakeholders, the end result will be a better decision. And there will be, also, a more disciplined decision makers. If the decision makers do know that their decision, their processes, their guides are being, scrutinized by different stakeholders, will be more disciplined. And the element of using this stakeholder participation as a way to educate, as a way to get stakeholders on board on a process that is not very easy, a process that is clear, basically saying yes, but also saying no, and a process that does imply, basically making hard choices when there are constrained budgets, which is normally the case. It increases ownership, and importantly, in Latin America, it mitigates the risk of legal action, even though, we've seen some data basically saying that increasing stakeholder participation in a lot of countries doesn't necessarily reflect on, reducing on the individual claims, because a lot of the judicialization in Latin America is done at the individual level rather than, at the organizational level. Next one, please. So the reality in Latin America, as we just heard, even though it's been identified as a best practice, even though it's clear that it brings a lot of benefits, is that the stakeholder involvement is inconsistent and it's not being clearly implemented throughout the region. We heard some of the reasons from the previous presentation, and I think I would emphasize on the how. I would emphasize on, a lot of countries do have, a lot of governments do have the mandate to involve stakeholders in decision-making processes. For instance, we know the experience in Colombia where the court basically mandated, the executive mandated the government to incorporate stakeholders in any decision made on excluding technologies from the health benefit package. But then getting down to the how, getting down to making sure that it is inclusive enough, but it's still manageable, it is still within, the time frame that is needed, is all a challenge for policymakers. It's not very easy. It's not that there's a lot of experience in the region, or actually a lot of experience worldwide in terms of the best practice to do it. It's the best practice in terms of doing it, but the how, and that basically means not just when, but also, the different elements that need to be taken into consideration. Next one, please. So we think, and this is some work that we did as part of a guide for policymakers. It's a book called What's In, What's Out from the Center for Global Development. We think that, there should be some attributes of stakeholder participation. That this was done in the context of health benefit packages, but clearly can be extrapolated to health technology assessment overall. The first one is it shouldn't be another checkbox the policymaker will need to go through to basically comply with, a mandate, or basically, fulfill some criteria. It should make a difference. And for this to be relevant, it should be planned and it should be funded appropriately. Normally, policymakers do set some money for, cost effectiveness studies, do set some money for, additional data gathering, but there isn't, a clear budget line for, running these processes, putting together the guidance, putting together the clear elements of how this will be done in place, learning from what has worked, what has not worked as this is in iterative process, and this is a repeated exercise. Participation should also be, transparent, honest, and clear. I think expectations should be set at the beginning. It's not that stakeholder participation basically means that this is a decision that is done on a consensus basis, or a decision that is, or that each step of the process will have the same stakeholders with the same level of participation, with the same level of interaction. And I think setting up the limits ex ante, defining the limits and defining the when and the how ex ante, it basically helps defining clear expectations for all the actors that will be involved. Different participants will be needed at different stages, and different levels of participations will also be needed. We'll see that how, there are different levels of participations with different costs, with different timeframes, with different levels of engagement. And I think everything should be planned beforehand, and it should be communicated clearly to everyone involved. And participation should be accountable, and there needs to be a way to feedback the cycle, to feedback the decision makers, for decision makers and the whole society to learn what has worked and what needs to be improved. The final 2 points are about, one is mutual learning, something I said before. it needs to be a virtuous cycle when, people do accept that, there needs to be a learning curve. Elaine talked about the training and how, from the outset, different stakeholders have different levels of power, have different levels of information, knowledge, and experience in these processes, and how everyone should be able to participate appropriately and actively at the right time in the right way. So that means using the right vehicle to also entice and get the right participation and input. Next one, please. I think in terms of who should be involved, there's a big question mark there. Sometimes, this is mandated by, the law. Sometimes this is a decision done by policymakers. Sometimes, it depends on how close stakeholders are to, the decision makers. We heard about advocacy, and that is a double-edged sword, because, sometimes those groups that advocate the most are those that get invited, but that doesn't mean that you get the right level of representation, the right level of inclusiveness, the right level of, participation from the different groups. Also, I think it is important to be clear here that, being explicit about who it is that is participating is extremely important. So declaring conflict of interest, declaring sources of funding, declaring what voice you're taking to the conversation, it is extremely important. In some countries, like in Colombia, the Sunshine Act was put in place first as a voluntary mechanism with the idea to basically get all the groups, not just health professionals, patient groups, but all groups to clearly, disclose, as well as the pharmaceutical industry, to disclose, what exchanges, what money, what had been exchanged, how people are funded, and what exactly is being, taken to this exercise. I think there are people who argue that, civil society, patients, and society at large should be included. I think there are different examples and exercises in terms of the best way to do it. Importantly, the civil society organizations normally are organized by disease. Sometimes are organized by, specific conditions, and that basically means that whoever is making the decision or who's involved need to be very explicit about being able to include representatives from society at large, and not some specific diseases and conditions. Next one, please. And here you see, we've talked a lot about participation as a whole, and we've talked a lot about the how and the who, but here is the when, and the when it depends on the step we're talking about here. On the left, you see how NICE does it. So NICE have these 11 steps when technology appraisals are conducted, and the steps have different levels of engagement by different stakeholders. And I think this level of clarity is important. The devil is in the detail here. And on the right, you see the ICER, which is the Health Technology Assessment in the US. Also, they have explicit steps identified with explicit stakeholders and explicit levels of involvement. As I said, it's not doable or viable, easy to have the same level of engagement by all stakeholders at all steps. So it's important to prioritize and decide in what step you need what stakeholder to provide the best value add. And that basically brings us, next one please, to the different levels of participation. So sometimes, the easiest way to do it is to inform, healthcare professionals or patients or caregivers. And that's not the ideal way of doing it. This is the cheapest, and sometimes is the way that governments and policymakers do it. It's got a lot of downsides because people don't feel that they have a say on the decision. People don't feel that they've been consulted. People don't feel that they have been able to express their priorities. But that's, I guess, the baseline. Sometimes, and historically, some governments have not even informed properly and communicated properly the decisions. So that's the baseline. Then you get into consulting, and consulting does take, you know, a bit more time and engagement and resources, but it's important because, you know, you are open, you are honestly open the case for the stakeholders to communicate, you know, their perceptions, their feelings, their interests, their priorities. But the decision when you're consulting is still lies within, you know, the decision maker. Consulting doesn't mean that, you know, you are getting a deliberative process and you're getting stakeholders to participate in the final decision-making process. Then you get involvement and collaboration and empowerment. And those are, I guess, the three ideal scenarios where you actually have a more deliberative process where people not just provide input, but also participate in the decision. I think the experience we've had in Latin America with this is very limited. Sometimes in some countries, there were few pilots or few experiences of including stakeholders and getting decision by consensus. It didn't go that well, for instance, with the Law 100 was passed in Colombia, and there was the you know, the council of stakeholders where everyone had a representation. It was impossible to make decisions. It was impossible to move forward with a clear single, you know, decision, and the government felt that it didn't have control over the budget. So I guess there have been failed attempts, and that basically takes us back years. So importantly, whenever the guidelines, whenever the processes, whenever the methods are decided, you know, these elements will need to be taken into account, and these elements of the how and the devil is in the detail will clearly need to be considered. Next one, please. You know, in terms of challenges, I talked about the conflict of interest. I talked about the perception. I talked about the time, the budget, the difficulty in getting everyone involved, the difficulty in getting everyone involved at each stage of the process. But here, there is some report from, you know, 40 representatives of HTA bodies, governments, and different, wide range of stakeholders. And I think the biggest concern they raised at the time was, you know, they raised the concern that certain groups, for instance, industry, could have an excessive influence on setting the agenda for prioritizing, you know, the technologies that would be assessed. And that, I think, it doesn't need to be the case and shouldn't be the case. And importantly, you know, and that is why clearly the stakeholders should sign the conflict of interest and should be explicit about what voice they're representing. The concern, I think, here was more pronounced in countries with a lower level of HTA institutionalization. And I guess the plea here is the clearer the rules, the clearer the structure, the clearer the processes, the lower the risk of basically getting undue influence throughout. Next one, please. So finally, I think we have seen how participation is important for its own sake, but also to improve the governance of decision making and to improve the quality of decision making. In addition to other benefits, it is difficult to get it done. The how is not really worked out. It depends on the context. It depends on the law. It depends on the stakeholders that are relevant. And I think it is important that we get down to the details ex ante, meaning guidelines should be developed, processes should be put in place where the key attributes are explicit, the decisions in terms of what it is that stakeholders will contribute and the level of participation are explicit, and some of the risks that I've identified here are also mitigated. So it's a long path ahead. I think we are on it. I think we are making progress, but it's not an easy path. And it's basically easier to say that participation is important than to actually get real participation to take place and to reap the benefits, mitigating for the challenges that stakeholder participation might entail. Back to you, William, and thank you very much.
Thank you very much, Javier. I think another extremely well-informed and very interesting presentation. I think, as you say, good to think that we're on the right path at least, but still some distance to go. Let's go to some of the Q&A, and I think I'm going to start maybe with the broadest question here, which I'll ask to each of you. So this is from Miguel de Bustamante. Curious to hear your perspectives. Is it realistic to expect patients or patient groups to participate in HTA processes, or should HTA institutions proactively seek patient input in their assessments? And maybe, in relation to that latter point, do you have examples of how that has been done, or agencies that do a good job of proactively seeking input? Let's go to Aline first. Interested to hear your views on that question.
Yeah, thank you. Thank you, Will. Thank you, Miguel, for your question. It's a very important question. And yeah, I think it is realistic to expect, because we are seeing this. We have some country examples. So one example that is always mentioned is NICE in UK, and they are doing a very nice job, and for like more than 20 years, they are involving stakeholders, public, patients, and CADIT in Canada. They are doing an excellent job as well. So sometimes they seek patient input. For example, here in Canada, CADIT is the main HA body. So they do they search for the evidence, for patient-related evidence, real data, real world data, and then they send the recommendation to the provinces, and each province, they are independent to do to make their decisions. So here in BC, for example, when they receive those recommendations, if they feel that they need more evidence about patients, for example, if there is the context is very specific, they seek for patient input. So I had the opportunity here when I was doing part of my PhD studies to be part of some interviews that they conducted, and they really seek for patients for that specific condition, etc. In Brazil, for example, Brazil is another example. They have public consultations that anyone can participate. The involvement of patients is family, caregivers, health professionals are huge. It's a very expressive number of inputs that they receive. And they also have public hearings sometimes that started last year. It's part of the law. It's part of the law to have public hearing, but only last year they started having public hearing. So after 10 years, the first public hearing happened last year, and then patients could be there, health professionals, patient groups, they could be heard. And Conozca, for example, in Brazil, they are now inviting patients for specific conditions to share their perspectives to give their testimonials. So for 10 minutes, they hear. It's a consultation. So I think Javier's presentation was very complemented by what I said. We complemented each other. I really enjoyed seeing his presentation, because he showed the ladder of participation. So I always say that in Brazil, what I see is we have the two first steps of participation. We have information and we have consultation, for example. So they consult these patients. The patients, they go there, they give their testimonials for 10 minutes, and then the meeting, the plenary, the people that are there, the committee, they discuss about what they heard. But we don't have effective involvement. People are not there making decisions. They are not deciding anything, but they are being heard. In Australia as well, the patients, they have opportunity, patient groups, they have opportunity to give their testimony. So we have many examples around the world, that patients and patient groups and society in general, they are participating in the HA process, and even in the organizational process. Cadets, for example, they have a committee, a patient assistance committee, that they are part of the whole process. Everything the cadets is going to implement in the organization, they share with this committee, and they have the opportunity to give their input about decisions about the organizational process as well.
If I may, William, I think, patients are extremely relevant, important. Their input is extremely relevant and important, especially when you are talking about, quality of life, especially when you're talking about how a new technology will impact, their lives. And I think, importantly, they need to be part of the assessment in terms of determining what health outcomes are the priority health outcomes to look for and to gather evidence on. When I was at the Colombian Health Technology Assessment Agency at the IETS, our manuals basically explicitly said that the patients needed to be involved to rank the health outcomes that would be included in the evaluation. Also, in a lot of countries, exercises have taken place in terms of determining the EQ-5D quality of life scales, and some patients have been involved in ranking, the different conditions as well as quality stages. The other stage where I see a big relevance, and I think this is not. This is again consulting, is nominating topics and the topic selection process, and that is where not just patients but society at large could actually determine what the topics are, and not just what topics will be assessed, but also what criteria will be used to determine the topics. I think determining the criteria, putting weights on the criteria that will be used to determine the topics is a very important phase where the patients could be part of. Back to you.
Great, thank you. So let's go to some of the other questions with the last few minutes that we've got. Question from Jose Noguera. What can we expect with the task force announcement in ISPOR 2022 in Washington, D.C.? Would anybody like to start us off on that one?
I think that is down to the ISPOR representatives that I shouldn't be speaking on their behalf.
Yep. I think if you can offer any more clarification, Jose, on exactly what you're looking for in response to that question, maybe that will help us. In the meantime, we'll go to the next question. I think we had a question about examples from Argentina and Colombia. I think we actually covered a lot of those examples in Alini's previous answer. How about this question? So this is from Daniela Agramonte. What would be the best way to encourage patients to take action and develop their position? So I guess, again, going to Alini first, from your research, have you seen approaches that work best in engaging the wider patient community in this topic? Are there ways that we should be looking to speak to them that are more effective or less effective? What does your research have to say about this question?
Yeah, I've been following this development of patient empowerment in Brazil, specifically since 2012, something, since 2011, so it has been over 10 years. And I think training is very important, as all participants that I interview in this recent, in this current study, everyone mentions training, how important it is to bring patients to try to empower these patients and to say it's your right, because many people, they don't know, they don't understand that it's their right to participate, to be involved in a democratic country. It's a democratic process. So you're right, it's not the government's not doing you a favor. So it's our right and we need to do this as citizens. We need to get involved. So I think people need to hear this. So, for example, when I was part of Conitec in Brazil, in the Brazilian Ministry of Health, I used to work for Conitec for 6 years, and we organized an event in 2017, for example, and we had more than 100 participants from different patient organizations from all around the country, from all the regions from Brazil. And it was very important to open the dialogue and to tell them that they have options, they have tools to get engaged, to get involved, and how important it is to have this input from them. But this dialogue needs to be constant. We have to have constant policies for patient and public engagement. We cannot open the dialogue and close and open and close. So people, they need to feel they are being heard. And I think this is not, as Javier mentioned, it's not just to legitimate decisions, but it's to improve the decisions that are being made. So it's very important. And there are ways. I think training is the most important thing.
Yeah, I think the first we need to acknowledge that there are different levels of power, information, experience, expertise, resources. So there is not an even playing field. So importantly, when patients get together, it is important to acknowledge that there is a learning curve in terms of understanding how the system works, understanding where the decisions are made, understanding why decisions are made, understanding the processes behind and the principles behind the decision-making process, and then participating in actively in those growing growing spaces and opportunities that are being created, exchanging I think lessons, exchanging experiences, I think is also important going forward. Sometimes we clearly see how some organizations, and I'm not talking just about patients, some organizations just get down to their own single laser approach to a particular issue without considering the positions made by the other stakeholders. And being part of these processes will help understand how my position compares to the position from this other patient organization or this other provider representative. And I think this is also the beauty about the deliberative processes. That is a learning experience that as a society we can all learn from each other, that we can all see the value in putting yourself in someone else's shoes, and seeing the value in deciding and making sure that we get the best health for the money.
Thank you, Javier, and thank you, Alini, both of our speakers. I think in respect to everybody's time, I'm going to close the call now. I think it's been an excellent discussion, and I think, to end on an optimistic note, it's great to see this discussion really taking place in a lot of countries in our region. So I think, there is obviously progress to be made, but we're at least having the right conversations, I believe, and you guys have both made excellent contributions to that today. So thank you very much. Thank you to all of our participants and viewers. And I hope you'll join us for the next webinar, which I believe is going to be in September. You will be informed about it through ISPOR. Thanks, everybody, and have a great rest of your day.
Thank you.
Thank you, everyone, for joining today's webinar. As a reminder, the recording will be made available within 48 hours via email and can also be accessed on the ISPOR webinar series webpage. Thank you again for your participation in today's webinar.